Good evening students, I am Dr. Ganesh Kumar Patel and welcome to Radiation Oncology course. This is the lecture number 31 and the title of the lecture is the Radiation Safety Part 1. So before continuing the Radiation Safety Lecture 1, I want to accomplish my proton therapy lecture, previous proton therapy lecture with some 2 to 3 points. So in my previous lecture we were understand the beam delivery system, that mostly the passive scanning system and active scanning system, and we understand how it works. So here you can see that this is the facility of a passive beam scattering system, or called a compensator, which is on the left side and aperture on right side. This is we understand in passive scanning system there is a role of ridge filter and there is a role of compensator. So on left side this is a ridge filter or rotating modulated wheel type filter, and another is a your compensating filter, which homogeneous dose distribution according to. Now I will explain that presently commercially available proton therapy system, which you can see at the figure at these figures. There are commercially proton therapy producers are IBA, Varian Medical System, Mavion, Monarch System, and it is categorized into isochronous cyclotrons and synchrocyclotrons. So we must understand some common parameters or some basic parameters, like the IBA has a highest weightage in terms of weight. The height is important, and the energy, this is very important. So IBA proton therapy maximum can produce 230 of MeV, a Varian has a 250, and this synchrocyclotron has also 250 and 230. Beam type structure, like in LINAC pulsed and continuous, here it is a continuous mode, and here it is a synchrocyclotron have a pulse mode. And peak magnetic field is 2.9 Tesla, 3.8 Tesla, 9 Tesla and 5.7 Tesla. So these are the some characteristics of a existing commercial proton therapies which are produced by some manufacturers. Overview of the main properties of a commercial is little bit we have already discussed. Now we will explain about the radiation safety, because my lecture is related with the radiation safety, today's lecture. So how the radiation safety in case of proton therapy. If I speak about the radiation safety in proton therapy, the proton therapy, because here particle is accelerating with highest energy and there is a probability of production of other charged particles, because interaction with matter with such a high energies can produce a photons, protons, neutrons, and the concern in the proton therapy is the production of neutrons. So you just look at the picture. This is a simple two gantry system of a proton therapy, and you can look at the shielding bunker or bunker of a proton therapy center. Here the width of a wall is around maximum 4.5 meter, 1.5 meter, 2.2 meter, 2 meter, 2 meter, and maximum is nearby transport system is 4.5 meter. So you can imagine that the shielding thickness or the requirement of shielding is much higher, almost double against your linear accelerator, where energy is very much limited, but here energy is very much high. And the radiation safety concern with the proton therapy is right now only the production of neutrons. Neutrons are concerned. That is why the ambient dose is the dose which is received by a radiation worker when once the beam is off. After the beam is off, there is a interaction of radiation with the head or other outside structures, and it produces neutrons. That neutrons exist for some time. The time for which it exists, and the person once he enter into the gantries, he received the dose. That dose we call ambient dose. So that is why the present proton therapy centers have coming with a multiple gantries, because the production is taking time, and the ambient probability of increased ambient dose can have a radiation safety issues. So we will now continue with our radiation safety. Okay, first we will understand what is radiation. We are surrounded by radiation. Radiation is everywhere. But how we can understand that radiation is harmful or not, or radiation is harmful? Because right from your mobile phone to your surrounding walls, everything, you are all forms radiations are there. So basically radiations are two types of, there are two types of radiations. One is ionizing radiation and another is non-ionizing radiation. As I said that we are surrounded by radiations, so we are not we cannot all radiations are not harmful. Like electromagnetic wave, like microwaves, radio waves are non-ionizing type of radiations. Non-ionizing radiations that have not sufficient energy to remove an electron from an atom. It means that it cannot ionize, it cannot produce ions, like radio waves, microwaves, infrared radiation, visible light, lasers, ultraviolet light. All these are the non-ionizing radiations, and the risk from these radiations are almost negligible. Another is the ionizing radiation, the radiation that has a sufficient energy to eject electrons from atoms. That is, it means it ionizes the atoms, like alpha particle, beta particles, X-rays, gamma rays, neutrons. All these particles ionize the atoms and produces ions that can damage the DNA, and these are the harmful radiations. So before understanding, we must understand what is electromagnetic wave. Electromagnetic wave is consists of a range of different frequencies and wavelength. If you will look at this figure, radio waves, microwaves, infrared, visible, ultraviolet, X-rays and gamma rays. So as the wavelength decreases, your ionization increases. Like where these types material radiation type material in building material. In building material there are some things which are also radioactive, like honeybee, pinpoint, protozoas, molecules, atoms. All these things are consist of some types of radiations. And I said that ionizing radiation is omnipresent, like from your soil. Terrestrial radiation from the rocks and soils means, as you know that all kind of different radioactive materials obtained in from the earth crust, and buried radioactive waste, and cosmic radiations coming from space, that is called cosmic radiations. Also we are exposing with that radiations. Then natural sources of radiations like uranium, plutonium, there are many sources of radiation, and man-made sources which is generally artificial sources, and nuclear weapons, nuclear power plants, dental X-rays, nuclear power plants. All these are, we are all aware, surrounded from radiation. So sources of ionizing radiation: natural radiations like cosmic radiations, radiation within our body like potassium, carbon. These are also radioactive elements. In food we eat, in water we drink, house we live in, lawn, in building material. So we cannot prevent exposure due to natural sources. So man-made radiation, man-made sources include fallout from nuclear weapons testing, nuclear explosions, extra cosmic radiations during air travel, means flight, exposure from medical diagnosis, and therapeutic like radiotherapy, nuclear medicine. But radiation doses to patient and operators due to medical diagnosis, can be minimized. So if there are so many advantages of radiations, then why we are using? The balanced use of radiation is required, means because radiation is like a two-edged sword. There is a benefit and there is a risk. So if the balance of this thing is more benefit for the society. So like radiation in medicine, so from the step of diagnosis to the step of treatment, most of the cases we are dependent on the radiation, like your X-rays, your CT scans, your linear accelerator, your radiotherapy treatment, your nuclear medicine treatment. These are the applications of radiations in medicine, which is of significant, which has revolutionized the medical field. So what is the annual global X-ray exposure? So in all over the world, diagnostic examination around 3.1 billion, dental X-ray 0.5 billion, and collective effective dose is 4 into 10 to the power 6 man-sievert. So effective dose per person is 0.62 millisievert. So contribution due to the CT scan is highest, which is almost 43% of the collective dose. Contribution to the interventional radiology is 8%. What harm can X-rays cause? X-rays are the ionizing radiations and cause biological effects in the exposed person. The nature of biological effects depends upon the dose delivered and the chronic or acute nature of the exposure. In routine general diagnostic radiology, the radiation doses dealt with very low, and these effects are not normally observed. So we must understand what are the biological effects of radiation. So before understanding the biological effects of radiation, we must know some basic terms of the measurement of a radiation. First term is the exposure. Exposure is a radiation quantity which is defined only for the air. It is defined for the air medium. So it is the measure of charge produced in a unit mass of air from the ionization by gamma and X-rays. So this is nothing but the ionization in air. Air also consists of atoms. So atoms of air gets ionized, in that because of that ionization, whatever the energy is deposited or charge produced per unit mass is called the exposure. The unit of exposure is coulomb per kg, and its special unit is the Roentgen. Another term is the absorbed dose. It is the energy deposited by any form of ionizing radiation in a unit mass of material. So this is defined for a medium. Exposure is defined for a air medium. Here it is defined for any medium or any material. So any amount of energy which is deposited per unit mass by the ionizing radiation is called absorbed dose, and the unit is joule per kg, and that joule per kg, 1 joule per kg is equal to 1 gray, and 1 gray is equal to 100 rats. This is the unit conversion you must know. Then after that, the equivalent dose. It accounts for the hazard potential of different types of radiation through a factor called radiation weighting factor, and its unit is sievert, and it is denoted by HT, that is equivalent dose, and it is the summation of radiation weighting factor into the absorbed dose. So it is a product of, it is a sum product of radiation weighting factor and the absorbed dose. Radiation weighting, what is the radiation weighting factor? Radiation weighting factor is that because ionizing radiations are produced from different types of ionization, like protons, electrons, photons, X-rays, gamma rays, neutrons, all these particles don't have a same biological effect. So that is why it has been categorized into radiation weighting factors. Another is the effective dose. It accounts for the different types of tissues and their sensitivity. Taken into account the tissue weightage factor, a measure of stochastic risk factor. Its unit is also sievert, because and it is the product of equivalent dose into the tissue weighting factor. You can see in this is HT is your equivalent dose, and WT is the tissue weighting factor. So here the tissue weighting factor is the factor which accounts for the different sensitivity, because the organ sensitivity with radiation is also varies. And this table shows how the radiation weighting factor for different particles and radiation weighting factor varies with the different particles. Like for photons, the radiation weighting factor is least. For electrons, it is also least, because photons and electrons are almost massless particles. As the mass of the particle increases, the radiation factor is also increases, because it becomes a high LT radiation. So neutrons has the highest radiation weighting factors. You can see that up to 2 MeV it is 20. So these are the factors. With increasing mass, the radiation weighting factor also increasing. Another is the tissue weighting factor. There are the human body consists of different tissues, and the different tissues of human body have a different radiation sensitivity. Some tissues are highly radio sensitive, some tissues are less radiation sensitive. So the highest radio sensitive tissue is the testes and ovaries. Then bone marrow is the highest, red bone marrow is the highest radio sensitivity, and we can see that the least salivary gland and skin has the least radio sensitivity. Bladder, esophagus have a least radio sensitivity. So we can see that bone marrow or breast or intestine or ovaries have the highest radio sensitive. So the tissue weighting factor of these organs are highest. So if these organs are receiving a dose and the other organ is receiving a dose, the probability of effective dose to these organs is more, because the factor value is more. Now mechanism of radiation damage. We understand what is ionizing radiation and non-ionizing radiation. Now in ionizing radiation, there are ionizing radiation is also categorized in two types. There, if damage, direct damage or direct effect, or indirect damage. Damage occurs due to the effect of radiation on the DNA of the cell, because ultimately the main significant part of the cell is the DNA. If DNA damage, the cell dies. Cells are capable of repairing the damage, but in a few of the damage progresses cause mutation, translocations, or cell death. There are two mechanisms. Direct damage, direct deposition of the energy in the DNA, predominant when the exposed to alpha particles, proton particles, or neutrons. So this direct damage is as we have seen in high LT radiation, so where there is a double strand break. Indirect damage, the deposition of energy in the surrounding water, and damage is caused due to the reaction of free radicals from the water and with the DNA. As human body consists of maximum quantity of water, in this indirect damage, the photons or low LT radiation, the photon or electrons first interact with the water molecule. With the interaction of water molecule, it produces a free radicals. Then these free radicals damages the DNA, and this is called the indirect damage. And in this case, the probability of single strand break is higher. So look at this figure. What happened with this radiation? Radiation can cause also a mutation. So what happened when DNA receives any kind of radiation, mutation gets repaired, because there is a basic nature of cell. Cell gets repaired, and if the cell is not repaired because of higher damage, it gets death. And if cell is survives, it gets mutated, and if it gets mutated, it causes a cancer. So this shows how it happens. What can these effects lead to? These effects lead to a genetic effects which carry from generation to generation: skin burns, infertility, cataract, cancer, and ultimately death. So biological effects, also tissue reactions, are called. There are these biological effects are divided into two types: deterministic effect and stochastic effect. Deterministic effect is that in this effect there exists a threshold dose below which the effect is not observed, like radiation, dermatitis, epilation, infertility. Severity of the effect increases with dose, and large number of cells are involved. So deterministic effect, as the name suggests, deterministics, it means that if a person exposed to a certain amount of radiation dose, which we call a threshold dose, there is a 100% probability that patient will have a cancer or some kind of radiation toxicity. That is called a deterministic effect. The other effect is the stochastic effect. Also we called it as a probabilistic effect, means there is a probability. In this case, there is a no limit of threshold dose, means there is a no certain dose is fixed that beyond this dose this effect will occur. There is only probability of those, and the probability increases with increase of dose. In case of deterministic effect, if you receive a dose less than threshold, there is a no probability of anything to happen. So there is a some threshold limit is there. There is a no capping. There is a no limit. So stochastic effect have no threshold dose, because according to stochastic effect there is no safe dose for stochastic effect, and probability of the effect increases with dose increase and can occur with a single cell also. So if a single cell also can be mutated, have a probability of cancer, which is not possible with which is not happen in case of deterministic effects. In short, we will differentiate stochastic effect and non-stochastic effect, also called non-stochastic effect. Due to cell changes, proliferation towards a malignant disease. Due to cell killing, there is a direct cell killing, because there is a threshold dose. No threshold dose, there is threshold dose. Severity independent of the dose. This is very important. Severity is independent of the dose. Here severity increases with increase of dose. Now factors influencing the biological effects: type of radiation. As I said that low LT radiation and high LT radiations have a different biological effects, which also we explained in the particle therapy. Types of exposures: acute or chronic. Chronic means prolonged exposures. Acute means immediate exposure, high amount of exposure. Types of cell exposed: somatic type of cell exposure, germ cells exposed. Types of tissue involved, like stomach, I said that there are various organs which are radiosensitive, like stomach is more sensitive than brain. Area of exposure, whole body or localized exposure, individual specific radiosensitivity. So what is somatic effect? Somatic risk may arise from the both stochastic and deterministic effect. Cancer induction is the largest risk of radiation. Bone marrow, gastrointestinal tract mucosa, breast tissue, gonads and lymphatic tissue are most susceptible for cancer induction. So what is somatic effect? As I said that in human body there are tissues which are highly radiosensitive, like gonads, bone marrow, and if the person with such organs received a certain amount of dose, there is a possibility of somatic risk, which comes into both stochastic and non-stochastic category. But in case of genetic risk is the result of radiation exposure to the gonads. Genetic risk analysis assume that exposed population consists of all ages and both sexes, and severe genetic effects in the next 2 generations. So as know that genetic information carry from generation to generation, and the genetic significant dose is indexed to estimate the radiation induced mutation in germ cells of a cell given population. Now fetus risk. Doses lower than 100 milligray generally carry negligible risk. To avoid congenital abnormalities, abortions may be advised only when the doses received by a pregnant woman greater than 100 milligray. The fetal dose from medical diagnostic procedure rarely exceeds 50 milligray. So this will not put the fetus any significant increase in the risk of congenital malformation or growth retardation. It has been observed that many female patients during her pregnancy has to undergo on emergency basis for diagnostic scans. In such a cases, we must understand we have to limit the diagnostic dose not greater than 100 milligray, because less than 100 milligray the probability of congenital abnormality is very less. Another is the 10-day rule, which is need to be keep in your mind. 10-day rule is defined for the woman which is going to be pregnant or which is just she conceived. So 10-day rule was postulated by ICRP, International Commission on Radiation Protection, for women of reproductive age. It states that whenever possible one should confine or one should restrict the radiological examination of the lower abdomen and pelvis to the 10-day interval following the onset of menstruation. So this is the important line which you must understand. Whenever possible one should confine or restrict the radiological examination like X-ray or CT, lower abdomen and pelvis to the 10-day interval following the onset of menstruation. So this is the 10-day rule. Now how the deterministic effect? As I said that in deterministic effect there is some threshold dose. So we understand what happened with deterministic effect and what is the whole body dope exposure for to happen a deterministic effect. If it is less than 0.1 gray, no detectable effect. Above 0.1 gray, chromosomal aberrations, this is one of the DNA damage, chromosomal aberrations detectable. Above 0.5 gray, transient reduction in WBC counts, that is bone marrow depletion. Above 1 gray, nausea, vomiting, diarrhea, this is a concern. This is gives the immediate effect, or it gives the immediate response of radiation like NVD, nausea, vomiting, diarrhea, if the person is reaching 1 gray or more than 1 gray. 3 to 5 gray, lethal dose. 3 to 5 gray is considered as lethal dose, which called LD 50-60. Lethal in 60 days to 50% of exposed population. Means once the population receives like such a 3 to 5 gray dose, the 50% population which is exposed will die in 60 days. 5 to 10 gray is increase in severity above the effects almost 100% death. This is lethal dose and this is the dose of death, simple, 5 to 10 gray. So these are the doses for deterministic effect. Deterministic effect for local radiation, which acute radiation effect. 0.15 gray if region testis is a radiosensitive organ. Ovaries is a radiosensitive organ which comes into the germ cells. Hair follicles, eye, skin, these are the skin is not radiosensitive. Okay, so when these organs receive such an amount of dose, there is a risk of temporal sterility, permanent sterility, temporary sterility. And if I received a 5 gray dose, there is a possibility of cataract, 6 gray can have skin erythema, 10 to 20 gray have a burn, blister, wounds, necrosis. These are the examinations where patient can receive this much of dose. I said that earlier, CT scans have the highest exposure, highest dose deposition. So that is why it is recommended that only justified CT scan should be performed by the physicians. So CT chest is 7.9, CT head 1.8, simple radiography X-ray is 0.021. Interventional radiology is highest radiation dose, fluoroscopy and dental radiography has dose. Now ionizing radiations, we lie with 2 to 3 millisievert per year and greater than 30 millisievert per year in some places. 30 millisievert per year in some places means area which are the seaside areas like coastal areas. In coastal areas, in India, our coastal areas are highly exposed with thorium radioactive material. So those people are residing in the coastal areas, they get a background radiation. This is called a background radiation. They have a highest exposure of background radiations of 30 millisievert per year. Those people are not staying in a coastal areas. They have average 2 to 3 millisievert per year. So this is a background radiation average person received in their every year, and which can affect 4000 like millisievert can kill you, or it is a killing effect of dose, killing effect of radiation. Radiation protection. So as we understand how the radiation can harm us, now it is required how to protect from radiation and get its maximum benefit. So prevention of deterministic effect, limiting the probability of stochastic effect. So how to achieve? Data from the atomic bomb survivors and other sources shows a correlation between radiation exposure and increased cancer risk. So Hiroshima Nagasaki nuclear bomb attack, the people who survived from that horrifying incident, from there we get a lot of data, to correlate the relation between the amount of radiation a human received and what kind of effects can produced. So from that data it has been generated some limits or some tolerance limits for a human. So until proven false, the linear no threshold model of radiation exposure. So there are number of radiation models have been developed to understand the how much amount of radiation is harmful and how much amount of radiation is safe for a human. So we need to follow the basic principle of radiation, and we called this is the first basic principle of radiation protection is the justification. As I said that ionizing radiation or radiation is a two-edged sword. It has a benefit, it has a risk. To justify your practice or to justify the applications, because the radiation application is not only the medicine, it is in the industries, it is in the nuclear power plants for the energy generation, it is in the weapons of mass destruction. So there are so many applications of radiations, but these applications has to be balanced, benefit versus harm. So your practice should be justified when you are using the radiation or application of radioactive sources. That is called the first basic principle of radiation protection. Then optimization of exposure, optimization of dose. So all exposures shall be kept as low as reasonably achievable, economic and social factors being taken into account. So whatever is possible, whenever you are using the radiations, you must follow the as low as reasonably achievable level. Means you have to follow this thing that when you are using it, you should be very careful to minimize the use to get your work done. Then third is the dose limits. As I said that there is some data from the data, it has been understood that there are some radiation limits which are safe for the human, annual dose limits. These dose to individuals shall not exceed recommended limits, and these recommended limits are obtained from the regulatory bodies. There are national regulatory bodies and international regulatory bodies. So we have to restrict to the dose limits defined by the recommended regulatory bodies. exposure due to natural background radiation and medical exposure excluded in arriving at these dose limits, because at this, as I said, that everybody is exposed to natural background radiation. So these dose limits, from whatever the dose limits we will see here, it should be excluded from the background radiation. So how the doses can be optimized? If we just take an example of a medical examination, suppose these are the pictures of same patient with 2 micro Roentgen per frame, 15 micro Roentgen per frame, 24 micro. So same patient has taken 3 images. You can see that in this picture you can easily visualize these ventricles, or this is a simple heart image, but your dose is very less. So you can go ahead with this. This is called a optimization of dose, because in these 3 pictures you are getting a sufficient resolution for the your said purpose is satisfied. So you must go with this examination, that is called optimization. So this is also called a LRR principle. So now we will discuss in details about this basic principle of radiation protection in our next lecture. Thank you.